Hey guys, Dr. Jason Barker with the Natural Athletes Clinic, and today I want to go over some abnormal lab values that came back with one of my patients in the clinic. He's a 34-year-old male triathlete, and he's been training a lot. Part of his labs were some basic labs we did, and we found some abnormals on here. And I want to share these with you, and I want to share with you why it's important not to do a lot of heavy training before you go and get your lab work done, because it can actually lead to some abnormal findings on these lab tests that normally would end up worrying your doctor and, of course, worrying you, and then getting you into the system for getting more tests and more detailed studies. So we don't have to do that as long as we know your history. Unfortunately for this guy, I asked him, what his training was like before he got this blood test done. And he'd been doing he'd been doing 2-a-days. He did a long swim workout the morning of his blood draw. And of course, he came back with some abnormalities here. And he did all that training, despite me telling him not to train, like take a couple of days off before we get that, because this is what happened. So anyway, if we look at his blood work here, we did a CBC with a differential and platelet. So looking at, red cells, white cells, immune system, all of those things, everything here is within a normal range. But down here, when we look at the metabolic panel, you'll see this elevated BUN, that's blood urea nitrogen. That is protein metabolism breakdown product that comes out of the liver, but this is actually a test looking at kidney function, because the kidney needs to clear this stuff out. Hence, you wind up with nitrogen overdose, essentially. So his is very mildly elevated here at 22. Now, this BUN can be elevated in a number of conditions: kidney disease, hypertension, congestive heart failure, a lot of different situations here. But of course, his is very mildly elevated. So more than likely his is up because he is dehydrated. Sometimes you'll see this moderately elevated when somebody has gone and been very, very dehydrated over a long period of time, because that blood flow gets decreased to the kidneys, and you can see that stress with that elevated, and then that clears up later on. So anyway, elevated BUN. You go down here, you also see this high BUN/creatinine ratio. If you look back up here, his creatinine is normal. By the way, this is not creatine, the supplement. This is creatinine, which is another protein breakdown product. Remember, we're always recycling our muscles. We're always breaking down our tissue and rebuilding it. So everybody has creatinine in their bloodstream, but his ratio is just high just because his BUN is up and that creatinine is normal. So no biggie with that one. Now let me slide down here on this test. And okay, so here's the rest of his metabolic panel. Of course, all of his electrolytes, some proteins in his bloodstream, some other types of proteins. And then look at this, his AST, aspartate aminotransferase, is the long name for that one. And then ALT is alanine aminotransferase. These are, at least on this test, these are primarily measurements of liver function. Okay, so now his are mildly elevated, as you can see here. So normally your doctor, when they see this, they're going to ask you, how much have you been drinking? Because chronic alcohol ingestion will elevate these. We worry about things like fatty liver, start to worry about things like viral hepatitis, other liver diseases. Now, most often in cases like that, these are going to be a lot higher, but nevertheless, we want to see these normal. We don't want to see them elevated like this. So cause for concern. But of course, this guy had been doing 2-a-days most days of the week. The morning of this test, he'd done a workout also. So of course, these came back high. And the thing to remember here is that AST and ALT are not exclusive to the liver. They are also found in skeletal muscle tissue. So, he had been working his body, working his muscles, probably some higher amount of protein turnover. That's why these are higher here. By the way, this alkaline phosphatase here too, that's another kind of broad-ranging enzyme. Sometimes you'll see that one elevated too when there's a lot of tissue damage. If that one's elevated, we got to go and look at a bunch of other blood tests. So by the way, when we're reading this stuff, we're always looking for patterns among all these different findings on the blood test. So for this guy in particular, it was pretty easy for me to figure out that he'd been training heavy. That's why these are elevated. So I don't need to worry about other chronic health conditions going on with him. Now, two things here is that your doctor needs to know your history. Your lifestyle history is important. When these come back and they say, hey, we're worried about hepatitis, you need to remind them I just did a triathlon last Sunday, or I ran an ultra, things like that. They need to know your history. And then the second thing is that I'm not just going to say, oh, this is all due to training. I am going to repeat these tests on him in 3 months, albeit when he's had a week off, so we don't see a repeat of this, so I can rule any other issues out. But more than likely, that's what's going on with him. So moral of the story is these markers can be found to be high up to a week after a heavy period of exertion. So if you ran a race, you did a long run, whatever, anything like that, these can be up for a week after. So pick and choose when you're going to get your labs done. Let your doctor know your history. If you have to get labs done, take that into account that maybe you've been training or you did a race, and then that's why these things are elevated. Of course, we're always going to repeat these things to rule stuff out, but keep that in mind next time you get some labs back that look a little bit funky and your doctor hasn't asked you about that, okay? So hope this helps. Please share it with your friends who maybe had some abnormal lab findings that weren't explained by their doctor. Of course, give it a like and please subscribe to our channel. Thanks for watching.